And good morning, everyone. I'm Tom Gabrielle, President and CEO of the United Way of Westchester and Putnam, and I'm delighted to welcome you on behalf of my United Way colleagues from throughout the Hudson Valley, including from the United Way of the Dutchess and Orange region. We are joined by Jeannie Montano, President and CEO, and Melissa Clark, Vice President of Community Impact. From the United Way of Rockland County, Stephen M. Pappas, President and CEO. And from the United Way of Ulster County, we are joined by Sue Marcy, President and CEO, and Teresa Mulkins, Vice President. And finally, from the United Way of Westchester and Putnam, my colleague, Faith Ann Butcher, Chief Impact Officer. You will hear from many of them during today's webinar. Together, we are privileged to share with you data from the 2023 ALICE report across our 6 counties. As a final reminder, all participants are muted, so please ask any questions you might have in the Q&A section down below. And links to the website, the ALICE report, and any salient materials will be emailed in a day or two after the webinar concludes. Today's webinar, ALICE and the Crosscurrents, COVID and Financial Hardship in New York, will feature data from the 2023 ALICE report. Some of the data presented will be from 2021, the most recent date that data is available. And in other cases, extrapolated data or data taken from other sources through 2022 and beyond will be shared. Next slide, please. The ALICE report is brought to you by the United Way of New York State in partnership with United for ALICE, a driver of innovative research and action around financial hardship for ALICE households, which stands for, if you didn't already know, asset limited, income constrained, and employed. The ALICE report is designed to be shared with various stakeholders to inform policy and promote positive change for families living paycheck to paycheck. That's what the ALICE stands for. The ALICE movement was originally developed by the United Way of Northern New Jersey and has spread to 27 states and the District of Columbia. Next slide, please. Specifically, today's webinar features data from across the Hudson Valley in New York State and is brought to you by 4 United Ways: the United Way of the Dutchess Orange region, the United Way of Rockland County, the United Way of Ulster County, and the United Way of Westchester and Putnam. And we would like to thank the 16 community partners that helped us spread the word about this webinar, and will continue to share information about ALICE with the community. Today's agenda is an ambitious one, featuring a lot of data and several speakers. So I remind you, again, everyone's been muted, but please ask your questions in the Q&A section down below. Now, I'd like to turn the presentation over to my esteemed colleague, Teresa Mulkins, Vice President of the United Way of Ulster County.
Next slide. Welcome, everybody. So as we look at the COVID pandemic, which was a global health and economic crisis, we know that that upended life as we knew it 3 years ago. It claimed the lives of millions and unleashed a storm of competing economic forces, which is a phenomenon we have rarely seen in our history. Among those in the eye of this storm was a population that the media, government officials, influencers, and many others refer to as the invisible, the forgotten, people who, hidden in plain sight, struggle daily to afford the basics. We have a name and a specific measurement for this group, as Tom mentioned, and that is ALICE. ALICE stands for Asset Limited, Income Constrained, Employed. ALICE is most likely someone, or very often more than one person, that you know. They can be a family member, a friend, or a neighbor. ALICE workers, including our childcare providers, waiters, retail clerks, gas station attendants, and others, are the engines that keep our economy running. Very often, they are also our seniors, our parents, aunts, and uncles. They earn above the federal poverty level, but because their wages can't keep up with the rising cost of necessities, they're forced to make impossible choices to try to make ends meet by living paycheck to paycheck. Before we get into the depths of the ALICE 2023 ALICE report, we should go over some key terms that we'll be using through the presentation. Next slide, please. We just described what ALICE means and some examples of who may fall into that description. The other terms to be familiar with are listed on the slide. Those are a household, or who occupies a specific space. Housing survival budget, which is the bare minimum of costs that people need in order to survive. The ALICE threshold, which is the average income the household needs to afford those basics. And lastly, below ALICE threshold, or you may see on a slide as BAT, B-A-T. And lastly, the ALICE Essentials Index, all of which we'll discuss in greater details, but this at least gives you a small snapshot of what we will be talking about. Next slide. In the next few slides, we'll explore how the Hudson Valley's vulnerable ALICE families fared financially during the pandemic and warning signs that point to stress on the horizon for years to come. So how did ALICE weather the storm? Throughout the pandemic, economic forces such as job disruption, inflation, wage increases, pandemic assistance, and migration worked both with and against each other. Negative impacts on household income, business and schools closed or went remote for months after the pandemic hit. In the 2 years that followed, millions of workers lost their job or had to stay home to care for children not in school, while millions more had their hours and wages reduced. Initially, costs for many basics declined, and then as the pandemic continued, disruptions to the supply chain and higher wages to retain workers pushed prices up across the board, something we've all seen every time we've gone to the grocery store. At the same time, there were forces that benefited household incomes for many below the ALICE threshold, which means ALICE households and households in poverty combined. As I mentioned, wages and salaries increased as business owners scrambled to retain workers. There was also a set minimum wage increase. In 2021, minimum wage increased to $14 an hour in Westchester because it was considered part of the New York City metro area, and in $13 for other counties in the Hudson Valley. In addition, there were various temporary pandemic supports that provided a much needed cushion to struggling households. The pandemic also sparked changes in household size and location. The exodus of New York City residents to less expensive and or less densely populated location impacted the Hudson Valley significantly. Westchester County had the largest numerical gain in 2021, adding 16,600 households, and Ulster County having the greatest percentage increase at 8%. There were also many New Yorkers who moved out of the state. Additionally, to minimize expenses, many older children returned home and some households added roommates. Next slide, please. The number of households in financial hardship in New York continues to be undercounted in official measures. According to the federal poverty level, 14% of households in New York were in poverty in 2021. Yet United for ALICE data shows that another 30%, more than twice as many, were ALICE. The percentage of households below the ALICE threshold varied by location. 54% in New York City counties, 36% in the Hudson Valley, 29% in the Long Island region, and 39% across the rest of New York State. Next. As a result of all of these economic forces at play at the same time, from 2019 through 2021, there was a 5% increase in the number of households below the ALICE threshold in the Hudson Valley. However, the numbers vary from county to county and community to community, as these communities saw an influx in individuals and families moving in after leaving New York City during the pandemic, which skewed some of those salary thresholds. Slide. If we look at the counties, Orange County had 21% increase to the number of ALICE households. The ALICE households in Dutchess and Rockland counties grew by 10%. Putnam rose by 3%. Westchester saw a 1% decline, and the ALICE population decreased in Ulster County, but again, both of the by 10%. But again, both of those counties saw large influxes of population from the New York City area.
So it's kind of strange that there's such a drastic results between these 6 counties in the Hudson Valley. I'm going to explain why there's this difference. First, we need to have my video. "2021 was a unicorn year in that it was unlike any other that has been and any other that will be. In between the influx of money that was given into the community through the pandemic response efforts, to the job losses and healthcare needs of the community, and the drastic way in which people rethought their lives. And so that is one of the reasons why there's such a drastic increase between some counties, and a decrease in others. But we're going to go more through that. But when you really consider about the families, there was the child care dependent, the child dependent care tax credit, the advanced child care tax credit, which actually showed to improve. Didn't renew it at the end of 2021. There was the emergency SNAP benefits, there were the added benefits for the insurance payments. All in total for families, it could have been up to $22,000 that were added to their salaries. And yet this chart shows it still did not help some families overcome the poverty and ALICE threshold. As you can see, the bottom blue line is poverty. And if you actually look, poverty went up, okay? And the red line is ALICE. And the lines going around ALICE are those who are on the cusp. It's about 15% of the population that's going back and forth, that's teetering in between being ALICE and not being ALICE, right? Depending on whether or not maybe it's a month that has 5 weeks in it, right? That actually makes a difference. But sometimes it's just enough to be able to get you over that hump. For those tax credits, they helped a significant part of our population overcome that ALICE burden. However, those credits were not eligible for everybody. And for those that it didn't, who didn't benefit from it, they saw a decrease. And that is one of the reasons why we are seeing the difference, the drastic difference between our counties.
Good morning, everyone. So the question is, how much does it cost to survive in the Hudson Valley? Next slide, please. So what we're going to do is we're going to do a comparison to start with the survival budgets for the entire Hudson Valley. When you look at this chart, you see that there's the federal poverty line, then there's the New York State ALICE household survival budget, then the ALICE survival budget just for the Hudson Valley. Now, the gap between the poverty level and the ALICE is significant. And you can see that even in the Hudson Valley, when we're talking about ALICE, the survival budget is much higher for us in the Hudson Valley when you look at the entire region as a whole. Now, what we'll do is we'll go into each individual county. We're going to start out with Rockland County. Next slide, please. So for Rockland County specifically, what the difference is between the New York State ALICE household budget and the Rockland County budget, the two drastic differences that you'll see are in housing rent and then also in taxes. So the difference between the ALICE survival budget for New York State versus Rockland County, you'll see that there's a $1,200 difference for Rockland County for housing. And then for taxes, $289. Now, all it takes is 1 month not to be able to make your rent and you get thrown into a tailspin. So the idea that somebody can survive on $48,000 a year in terms of survival budget, that's cutting it close. We all know that. And that's why, these numbers, it's very difficult for us to say that this is where the line is, because you're just one paycheck away from making sure that you're on the street, you're not able to make your rent or something. Next slide will be Melissa Clark.
Thank you, Stephen. Appreciate that. For Orange County, we're going to look at what it takes for an Orange County senior adult to be able to make it as an ALICE. So you can see here that the survival budget just for rent is $974. Your hourly wage is $1970, and annually you need to make $39,396. Unfortunately, however, we know that a lot of seniors have extremely limited income and may be dependent just on Social Security. Next slide. Looking also for 2 senior adults in Dutchess County, again, you see that Dutchess County is higher than overall New York State. We all know that at the Hudson Valley, we are metro adjacent, so we definitely do have higher cost of living than in other parts of New York State. And I doubt a lot of you are able to find housing for $921, unfortunately. So just thinking about how all of this is connected, and we'll be going into that a little bit more in depth a little bit later on. Thank you.
So as we look at Ulster and look at a family of 4, you can see the story is the same across many of the counties. regardless of where you are. The New York State Alice household survival budget gives a rental cost of $896. But in reality, the survival budget in 2021 in Ulster County was a rent of just over $1,000. A lack of housing inventory and increased demand in Ulster have led to huge changes in the housing rental cost since this Alice report was published. And so you can understand how that would be a really huge lift for a family of four. If you're looking at an annual budget need of $64,000 or $32 per hour joint between the two adults in the household to support two children. When we look at the migrant population in Ulster County, it's important to note that many of those would not be eligible for some of those tax credits, and so that burden becomes even higher.
So in Westchester County, the situation is grim for one adult and one child households, where the Alice threshold is $59,328, almost $12,500 more than the New York State average. As a reminder, many of these numbers are estimated on the low side. For example, technology, $75 a month in technology. That's basically a phone bill. That's not counting Wi-Fi. That's not counting devices, etc. While others like rent and childcare costs are specifically a high burden in Westchester County. Notice also that the survival number includes significant tax credits, $932 worth of tax credits that appeared in 2021. Without them, that it would take one adult, one child households from needing $59,000 plus to more than $70,000 just to survive. Now, an important takeaway here is that at a time when minimum wage is $15 an hour, it would take two full-time jobs or an 80-hour work week plus those tax credits for a single-headed household with a child to survive in Westchester County. Take those tax credits away, which has happened, and that adult has to work a 90-hour work week. Next slide, please. And the situation is just as frightening in Putnam, if not worse, for a family of four, two adults and two children in childcare, where the Alice threshold is $101,652, almost $26,000 more than the New York State average. And just like in Westchester, this number includes significant tax credits. Without them, a family of four would need to earn more than $120,000 in Putnam County just to survive. Back to you, Melissa.
Yeah, thank you so much, Tom. So now we're going to be looking at a regional look of where Alice lives. So below the Alice threshold here, looking at Orange County, one of the counties that we're covering here, Dutchess Orange region, you're going to see that a lot of areas have an extremely high below the Alice threshold population. You're going to see a lot of metro poverty. You're going to see a lot of a high low-income population, all clustered, and you're going to see this throughout Orange County. And we're going to next look at some of the other cities here in Rockland and Westchester. You're going to see similar trends here. You're going to see a lot of the below the Alice threshold clustered in your more metro areas, but you're also going to see some more of that rural poverty and low income population as well. So now, interestingly, we've been talking a lot about where we're going to have higher groups of our Alice population. Now we're going to think about our lower groups of Alice population. So in quote unquote wealthy communities, you may not think that Alice or low income folks exist, but in fact they do. And you can look at some of our quote unquote wealthy communities here and what that Alice population looks like here in Westchester County. And then thinking too about some of the other areas in our regional look where Alice exists everywhere. So the takeaway here, of course, is where does Alice live? Alice lives in every community in the Hudson Valley. They're your neighbors, they're the folks that you see at the store, They're your friends, they're your family. We all either have been an Alice or know Alice.
To that point, absolutely. Alice, it is in existence amongst all demographics. It doesn't matter age, gender, race, ethnicity, geography. Alice does not know any borders in terms of that. But what we do see in terms of demographics of households in hardship, we see that there are some that are disproportionately Alice. Whether it's because of systemic barriers to education, home ownership, healthcare, financial wealth, savings, among a variety of others. There are reasons why some populations do get hit harder in terms of being within an Alice group. There are different groups. Example, in 2021, group 1 would be Black, Hispanic, seniors. Those groups would be harder hit. And then in addition to that, there are other groups that are married with children, white, with heads of households between the ages of 45 to 64. Those are, that's the second group that's most likely to be financially stable though. Next slide. So one difference that we have in the Hudson Valley compared to the national average in terms of children is that you see that children by household in New York State, that 52% of the children in New York State are actually living below the Alice threshold. They're underneath that BAT, as we were mentioning before, below Alice threshold. Now, when we're looking at household composition, single parents were more likely to be below the Alice threshold, with 56% of single male households and 62% of single female headed households struggling to make ends meet. Now, the rates of financial hardship were lower for married parents, where there's 23% of those within Alice, and single cohabiting without children at 40% within Alice. Next slide. Okay. Now, when we're looking at Hudson Valley Alice households by age of the head of the house, you'll notice that there is a trend towards the under 25 and 65 and over being more within the Alice population. So people that are just starting out in their careers or just getting into the workforce when they're under 25 are hitting harder into the Alice population. And then when people are 65 and over, our senior citizens, they're also within the Alice population. So when we look at the under 25, we can see that 38% of each households headed by people aged 25 to 44, and then 35% of the households are headed by 45 to 64 were below the threshold as well. Now, when we look at the Hudson Valley Alice households by age, we're looking at 2019 and 2021, where the rates of financial hardship were relatively unchanged for all age groups except seniors, because we know that the seniors population is increasing in terms of the percentage. So that's been a steady trend that we've seen, because there's been an overall increase of 4% between 2019 to 2021 in New York. And the rate of hardship for seniors grew from 53% below the Alice threshold in 2019 to 56% in 2021. Now, one thing that can be attributed to this is that we're seeing that many older workers were also forced to retire earlier than planned. And nationally, according to SHED in November 2021, 25% of adults who retired within the year prior to the survey, and then 15% of those who reported that they retired 1 to 2 years earlier said that the factors were related to COVID-19 contributed to when they retired early. So, is this one yours, Faith, or mine?
I'll take it. So in 2021, the largest number of households below the Alice threshold in the Hudson Valley were white. They made up 33% of the, 33% of the white households were Alice. However, the percentage of households for marginalized communities were higher, with the exception of the Asian community. For example, 47%, or over 42,000 of Black or African Americans were below the ALICE threshold, and 46% of those who were Hispanic, and 52% of Native American or Native Alaskan were below the ALICE threshold. Additionally, hold on. Although I found the sound works. Only 21% of the population ages 16 and over in Hudson Valley have a full-time position with a salary. So that means when everything, stops, as it did during the famous pause, right? The only ones who really there are only 21% of the population really continued earning that income, right? Because full-time salaried work brings greater financial stability, yet 20.5 and growing number of workers are paid hourly in the full-time sector. Workers who are paid hourly are more likely to have fluctuations in income due to frequent schedule changes and a variety of hours, and they're less likely to receive benefits. And they are just less likely to have to pay more for health insurance, have less time paid off, and have less access to retirement benefits. In addition, 40% of the population ages 16 and over in the Hudson Valley, which is a historically high number of workers, are out of the workforce. This is, keeping wages low, because and when workers are available, employers are less incentivized to give raises to attract employees. Are out of the workforce because of retirement, because of health or disability, or caregiving issues. This does also include students. So the next thing that really affected everybody's pockets is inflation, right? And inflation was not the same for everybody, because those who are struggling to make ends meet are not just focusing on getting their basic needs, had their costs rise at a greater rate than the consumer price index. So the United for ALICE has developed the ALICE Essentials Index. This is where they take into consideration housing, childcare, food, transportation, healthcare, and a smartphone plan. Again, not cable, just a smartphone plan. And they're looking at these measures to be able to see how much inflation has affected the ALICE population. Whereas this consumer price index actually does a categorization of over 200 categories, including many luxury items that isn't even in ALICE's, spectrum. So, and what we found is that the ALICE index, the ALICE Essentials Index in New York was 3.5% average over the CPI. An interesting thing in this chart that you see is actually the retail sales is the wage of the retail sales. And you can actually see in 2021, because of the mandatory increases in minimum wage, the retail costs were finally, the wages were finally hitting the ALICE point. And then because of inflation and the ALICE index shows it's still going just out of ALICE's reach. And you'll see that over time, you can see how since 2007, right, the ALICE index has always been just slightly higher than the CPI. And during the pandemic, they almost leveled off. And now that we're post-pandemic from 2022, if anybody has gone food shopping over the past year, we know it costs a lot more to fill the cart. And you can see here that there's a projected ALICE index of 6.4%. And I want to remind everybody, this isn't starting at zero every year. This is a build on top of the year before, right? So, what you're paying in 2022 was 6.4% higher than what you were paying in 2021. And like I said, we all know this because of our buying power, it's going down, right? These are different occupations, and the value of their dollar is going down. We're getting less by, what we do. And with 32% of the nation being at ALICE or below, we're having a harder time making ends meet. And in the Northeast region, we have the highest rate of inflation in the country. Greater than the West, which, for many years, had no problem taking the lead. Over the past 5 years, the Northeast has taken control, and we have the highest, which is affecting Alice. Is this Melissa?
Thank you, Faith. Now we're going to do a sort of deep dive into some of the issues. I'm going to be looking at food security. So unfortunately, food insecurity has been a persistent and troubling issue, as all of you service providers out there know. And as Faith mentioned, just all of us going to the grocery store, it's different. So in Dutchess County, for a single adult, you're looking at $495 of food costs for an average month. For one adult and one child, you're looking at $839. And for 2 adults and 2 children, and again, I know a lot of you are parents or caregivers, so I'm not telling you any news you don't know, is $1,479. So food costs are a significant burden to families, especially those that are ALICE or low income, in poverty. In Dutchess County, that subset is 35% that are ALICE or in poverty. And of course, you're going to see really high, like we talked about before, levels of ALICE in our more metro and also rural areas, specifically looking at the Poughkeepsie city and more rural like Amelia. Over 50%, unfortunately, of our Black and Latinx folks are in that ALICE category in Dutchess County. And 57%, very vulnerable population, your female single head of household. And we're really trying to highlight, of course, what ALICE looks like for those that have intersectionality with marginalized identities as well. Thinking about Orange County, your single adult is paying $478 for food each month. Your single parent is paying $811. And then your 2 adults and 2 children is paying $1,429. So again, this is a significant part of the household budget. In Orange County, you have 40% of your folks that are ALICE or in poverty. Again, very highly concentrated in your metro areas like Newburgh, Middletown, and Port Jervis. And again, unfortunately, over 40% of your Black and Latinx folks are in that ALICE category. And female single head of household is 69% in that ALICE category. So again, an extremely vulnerable population. A couple of other issues I want to talk about. We have talked a lot about inflation, and I know everybody on this call has been affected, and all of the folks and households you serve have been tremendously impacted. Of course, we also talked about our decrease in pandemic era SNAP benefit levels. That has been significantly challenging, as you're looking at that doubled with inflation being persistent and higher. That really just talks about generally how hunger remains a persistent and difficult issue in our community. And then just in my role, I speak often with food pantries. We also have our emergency food shelter program. So I do speak frequently with our food pantries across the 2 counties, and still many are seeing your first-time users of the food pantries remaining quite high. The New York State has made some strides to increase access to school breakfast and lunch, which is good news, but it's never enough. And then also looking at our 211 data, you have 45% increase in calls around food insecurity from 2022, which was 80% higher than from 2021. So again, I just can't say enough how this remains an extremely important and persistent issue. And something else I know was noted earlier, but I wanted to readdress, thinking about how all this is connected. And then we're going to be talking a little bit about housing and some other childcare and some other really extreme costly parts of the household budget. But you have your social determinants of health. So higher rents mean that families are making difficult choices between food, between medicine, between clothing, and other vital household expenses. I did just want to also mention that here in the Dutchess Orange region, we do have our food access initiative. So we are trying to bridge a lot of gaps and help a lot of folks that are experiencing food insecurity. We have our nutrition outreach education program coordinators who I know at least one is on this call, the other's on vacation. So that's okay. We'll let her have her vacation. But I will be putting, and we also have Caitlin Hinton, who works around helping folks that are in the school districts access their SNAP benefits. So we'll be putting all of their contacts in the chat in a few moments. But I did just want to mention that we at Dutchess Orange region know that food insecurity is a huge issue. And I'm not saying that we can tackle it alone. That's why we're all here working together and collaborating. And my other colleagues that are the United Ways, I know are doing amazing work. But I did just want to mention that we do have this initiative, and I will be putting that information into the chat. So moving on to my next colleague.
So as Melissa mentioned, housing is a concern that drives almost all of the other income burdens on families and individuals across the Hudson Valley area. When we look at housing in Ulster specifically, and we look at what the Alice survival budget is for a family of 4, it puts the rent at about $1,000 a month. When we look at the reality of what exists in Ulster County, that's a really far cry from what is available. A huge lack in housing availability, driven by the increase in the demand for rentals from people moving into the area, has created a perfect storm for families. A recent look just last week at apartments for rent in Ulster County, if we look at the 2 major centers, in Kingston, there was a total of 35 apartments available that are 2-bedroom. They ranged in price at a low of $1,400 a month and at a high of $2,995 a month for a 2-bedroom housing. So for a family of 4, that's a really, really hard push when we're looking at an estimated survival budget of $1,000 a month. If we look at New Paltz, it's the same situation. There were 8 apartments available, ranging in price from $1,650 to $3,650. Not sure that there are many 4-person households that could afford that with 2 working adults. The other part that we look at is what the breakdown of people who are renting in Ulster County is. We have 55% of residents here are renting. And of those, 55% of them are paying 30% or more of their gross income in rent. And it gets worse where there's 30% of those who are paying more than 50% of their income on rental costs. For Ulster County, we actually are the 6th highest of all 62 counties in New York State. And New York is the 3rd highest in the US for those who are severely housing burdened, meaning that they pay more than that in terms of rental. When we look at the availability, according to the Pattern for Progress recent report, just in 2020, apartment complexes had a less than 5% vacancy rate and a 2 to 5 year wait list. So for those who are lacking housing or are trying to find that, or who lose housing because of an inability to pay, falling behind on rent, have a major medical issue that makes it, impossible for them to be evicted, there is no place for them to go. And then we have the added stress of a short-term rental or Airbnb, where 3% of housing inventory is now short-term rentals. And Ulster County has the 3rd highest percent of housing that's Airbnb in New York State. So all of this combines to make a really, really difficult housing situation for families in Ulster County. There's a lack of affordable housing. There's a lack of housing in general, which is the same across all of the Hudson Valley, where we have very low vacancy rates. We need to look at the cost that's available and what to help folks who are in that Alice category. Because again, if you're living paycheck to paycheck and you have an appliance breakdown, a major medical expense, a car problem or an accident. All of those are things that can lead to a lack of housing and back rent, and then no place for those families to go. At United Way of Ulster County, we do have an emergency homeless prevention, emergency homelessness prevention fund that provides some assistance in that, and we'll talk about that a little bit later, because we know that that's a problem that exists throughout.
So when we're talking about ALICE and health, the obvious thing that we should touch on is that people within poverty and people within the ALICE population were the hardest hit in relation to COVID. And those are the ones that are experiencing long COVID, if not having family members that did pass away from COVID. It is a terrible situation where they were the hardest hit in relation to the pandemic. But in terms of other health issues related to it, as an example, in a September 2020 national survey, 36% of adults from 18 to 24 had delayed or missed healthcare services, whether it was dental care, primary care, any kind of preventative health screenings and such. They delayed those. And then when you talk about parents talking about their children, you look at another survey that was done in the fall of 2021, and the fall of 2021, there were delayed, skipped health visits for the children as well. Now, when you think about the comparison between ALICE, which was 36% below the ALICE threshold, that children were missing healthcare visits, versus those above the ALICE threshold, those were 21%. Now, on the screen, you'll see that there is information about mental health, because that could also push towards why people miss those healthcare visits. When you look at what you see on the screen, you'll see that within the normal area, the yellow line at the top, you'll see that below the ALICE threshold, and you'll see the above ALICE threshold. And then below, you'll see the ones in the blue and the purple. That's the one that we're going to focus on, where there's mild to moderate or severe stress, anxiety, depression, etc. Across the board, when there were periodic check-ins with people on a national survey, they did notice that ALICE individuals, people below the ALICE threshold, were exhibiting more stress, more anxiety, more depression. And that highlights that mental health is a very important need for people within the ALICE population. And we all recognize that there's a lack of mental health resources nationally, not just in the Hudson Valley, but this is a national issue. So there's that shortage, and it is a very big and real need that we're seeing within the ALICE population.
And of course, that brings us to childcare, which for many of our communities, especially Westchester and Putnam counties, is equal to or greater than rent itself. Consider the almost Twilight Zone-esque notion that the median hourly wage of childcare workers in 2021 in the Hudson Valley was $14.35. You have a scenario where childcare workers can't even afford to put their own children in childcare because it's actually more expensive than their rent. That's one of the reasons why the United Way of Westchester and Putnam launched its Education United after-school program in February. This is a free bilingual program serving more than 200 ALICE families and children in Ossining, and will be replicated in the fall in Greenburgh. It helps these families by enabling them to enroll their children in a free after-school program so that they can go to work and earn a few dollars more and not have to pay a tuition for an after-school program. So ultimately, they can pay bills and save for the future. The curriculum being offered through the Education United program helps close the learning gap that so many children that are living below that threshold experience. And because the Education United program is bilingual, it prepares children for future success. And finally, the wraparound services offered by our United Way family engagement specialists help families access additional programs and services, not just those that we offer, but that other nonprofit organizations offer, to make sure their children are set up to succeed for years to come. So in essence, we're helping families today and their children tomorrow. And that brings us back full circle to the reason why our United Ways are sharing the Alice report in the first place, which is to affect policy to improve the lives of the almost 40% of our neighbors in the Hudson Valley living in poverty or below the Alice threshold. With Alice falling further and further behind as the cost of basic needs increases, it's even more critical that we provide Alice families with the right supports. But many of New York State's public benefits are shaped by economic policies that are based on the Consumer Price Index. The Consumer Price Index conceals the rising cost of housing essentials. Those benefits end up purchasing less each year. This includes programs like Social Security, SNAP, Medicaid, and CHIP, pensions for veterans and civil servants, etc. The question remains, why do we use CPI to determine increases in programs like these when it conceals the rising costs of the basic needs that that Alice family so desperately needs? That's why we were focusing on, and it's so important to consider the Alice Essentials Index, things like rent and technology and healthcare and childcare, when we look at inflation and the impact it has on all of us. By increasing the accuracy of data on hardship, this and other Alice measures are designed at the end of the day to help lift all boats. Improving conditions for Alice families will in turn fuel economic growth, benefiting all households, communities, and businesses. Next slide, please. In the meantime, local United Ways are doing their part to support Alice households. If you're not familiar with the United Ways 211 helpline, all of us across the Hudson Valley collaborate on and support the 211 helpline, which last year provided 580,000 interactions or fielded 580,000 interactions, providing information and referral around basic human needs, or more specifically, the Alice Essentials. The program is free and confidential, available 24/7, 365, and you're able to speak with a live person, not a bot, in over 180 languages, and the staff are all AIRS accredited, Alliance of Information and Referral Systems. You can literally just contact 211 by dialing 211 or texting 898-211 or visiting 211hudsonvalley.org. But all of us do something. And I'm going to turn it over to some of our other United Ways to share some of that. Well, specifically, I'll start with Westchester and Putnam, that in addition, we offer our Essential Goods for Basic Needs program, which last year donated more than $5 million worth of new items, blankets, mattresses, diapers, backpacks and school supplies, Bomba socks, and so much more, so that Alice families can direct their income to other expenses. Through our Lyft program, we help individuals close the transportation gap and pay for their Lyft rides to and from non-medical emergency visits, job interviews, and even their first 2 weeks of work. And our Ride United Last Mile food distribution program, as well as other food distribution efforts, provides tens of thousands of free and nutritious meals to seniors, veterans, and families struggling to afford the cost of groceries. Again, all of them, Alice. But we aren't the only ones. Melissa, will you please tell everyone about some of the other things going on in Dutchess and Orange?
Yeah, thank you so much, Tom. And of course, we're a proud partner of the 211 network. It is such an instrumental, powerful resource for nonprofits, as well as folks in our community, Alice folks, but anyone can call 211. And I love too that we have our text service, we have our online service, and it is available 24/7, 365. So we are there in over 200 languages to help. So just wanted to mention that. We also provide funding to many different programs under health education, financial stability, over 40 throughout our Dutchess Orange region, and hopefully some of our community partners that are on here this morning learning about this data rollout. We do provide training as well to hundreds of our nonprofits, which increases their efficiency and be able to provide better service delivery. So that's absolutely important. With 211, we also have our Cash Coalition, and we are able to help thousands of folks, so about 5,000 folks, receive their free tax preparation program, their earned income tax credit, child care tax credit. They are able to put back $6 million into their pockets as a result, and bringing an economic impact through Dutchess and Orange region of 10 million. I did mention our new op coordinators, and I wasn't able to get the context out through the chat because of how it's configured, but we will send that information afterwards. Like Westchester Putnam, we also have an essential item program. So if you haven't, for you nonprofits out there, if you haven't been to our free store in our basement, please reach out. Rebecca Lill does a fantastic job managing that program, and we are able to bring back hundreds of thousands of dollars of new donated items out into the community, primarily helping survivors, unhoused individuals, foster children, those that are justice affected, vulnerable populations, many Alice populations, of course. And we also have a transportation service through Lyft as well. There's a lot more, but I know we are getting short on time, so I'm going to turn it over now to Stephen. Thank you.
Thank you, Melissa. So I'll try to keep myself short as well, because like Melissa, there's just so much that we do in so many different areas, but it really focuses on collaboration and working with our partners on the ground. As an example of, since we were talking about health in our section, we run the Healthy Havistraw and Healthy Spring Valley programs, where we work with community partners to discuss and address different health related issues within those populations, and culminates in a health fair at the end of the year, where we then try to teach the populations in need of what to do to better their health long term, to create better habits, to create better behaviors, to improve their health long term. And that's just two examples of programs that we run, in addition to the essential needs program that we run as well, and so many other things. But you know, we'll show our website letter, and it'll have a lot more information about all the variety of programs that we run. But in the meantime, Teresa.
Great, thank you so much, Stephen. So one of the programs that we run, which 211 will refer you to, is our Emergency Homelessness Prevention Fund that I mentioned earlier. Since 2014, United Way of Ulster County has been actively working to mitigate the impact of one-time emergencies and shortfalls that can send Alice individuals and families into some sort of economic free fall. The fund provides an emergency stipend to households to pay for back rent, utilities or fuel costs, appliance or home repairs, or emergency medical bills. Another important aspect of the fund is it'll help provide security deposits for housing, which is something that government assistance programs that are trying to get folks into housing won't provide, and is often an obstacle to families looking to move into more appropriate housing. The requests for these funds and the dollars allocated have only increased since the data included in this Alice report. From July of 2021 through June 2022, United Way of Ulster County assisted 1,086 individuals in 362 households with more than $289,000 in assistance. From July 2022 to June 2023, the numbers increased by almost a third, with 1,335 individuals in 445 households receiving $242,000 in assistance. So while the overall dollar amount stayed about the same, this was due to the fact that we actually had to decrease the maximum allotment for the grants in order to make sure we can meet the really drastic increase in needs that we've gotten, and make sure that everybody who requests funds can get some sort of assistance for us. The other part of that to note, and in keeping with the housing statistics for Ulster, is that 50% of those funds were for housing costs and 21% were for utilities. Showing that's where most people in Alice who are really struggling to make sure at the end of the day they can make ends meet, find there. We're very lucky to have a number of community partners who provide grants to support that, including private foundations and the county. And so we try to make sure that that's available through our fantastic partners at Family of Woodstock, who process those applications for us. Tom, you're muted.
Almost got through the whole thing without doing that. Thank you, Teresa. As a reminder, to find out more about what our United Ways do collectively in the Hudson Valley, visit our websites, which are on the screen. This concludes the formal Alice in the Cross Currents webinar. As we said before, the webinar, the Alice report, all of that will be shared with all of you and the community in the coming days. So please be on the lookout for that. If you have any questions, please put them in the Q&A right now. It's 11 o'clock, but we will keep this open for about 5 more minutes because we got started about 10:05 to allow everyone to join. I will read some of the questions that I am noticing in the chat, or the Q&A, I should say. How long did it take to gather this data and perform the analysis? Faith, you might be a better person to answer that, or?
So the United for Alice collects the data every 2 years, and it does take over a year to analyze the data, which is why it takes so long. And they are anticipating launching a dashboard in September with the latest information from the American Consumer Survey, which will also be dropped by the Census Bureau in September. So they are working to be able to continually update this information, but every time they do get it, it does take about a year to be able to go through the entire nation.
Another question was, when you calculate the housing costs, do you use the HUD numbers, the FMR rates? And if you do, does that include renters who rent out individual rooms at a markup?
They wouldn't include the rooms because they wouldn't have access to that information about the rooms. So
there was a question posed from the STEM Alliance, which is they were curious to know, is it worth having national organizations like the National Digital Inclusion Alliance advocate for a more realistic representation of technology costs in the Alice reports? Yes.
Yes, advocacy on every level would be welcome, not only to advocate to us, but advocate on behalf of us to help us, improve the accessibility to funding for people who are in Alice households.
There was an earlier question that I want to go back to, which I think is an important one, which said, is there any explanation for the need that everyone has to hire employees versus the amount of unemployed residents? Employment is a very complex issue. There is no one answer for anything. There have been national studies that are clearly showing that a percentage of the workforce has dropped out, is not even bother seeking employment. There is also changing landscape of the type of employment that we are seeing. More and more people are opting for gig work, which is multiple part-time jobs versus one full-time salaried position. We're also seeing, and I'm sure many of you can attest to this anecdotally, there's a lot more DoorDash drivers and Uber drivers and Amazon delivery drivers. Those jobs are proliferating now. Because they're paying a higher salary than what many of the minimum wage jobs were paying. So certainly in the nonprofit world, where many jobs are just at that minimum wage or slightly above it, $17, $18, $20 an hour, they're competing with DoorDash drivers and Amazon delivery drivers because that industry has just exploded. So there's a lot of different reasons as to why that's the case. Unfortunately, there's any one answer for anything. There was another question about, is the data consistent year over year, given that it does take a year to analyze the data?
So actually, this is for the most part, it's very consistent. The change actually happened with the last census, in that there's a difference in how the census is asking the race and ethnicity questions. So for this particular incarnation of the Alice report, they could not give us a back trend because the questions were different. But because typically the questions are standardized, we're able to use these year after year and watch for these trends.
And with that, we will conclude the Alice in the Cross Currents webinar. Thank you again, everyone, for joining us today. Thank you to all of our esteemed colleagues from throughout the Hudson Valley, from all the other United Ways, United Way of the Dutchess Orange region, United Way of Rockland County, and United Way of Ulster County, as well as my colleague Faith Ann Butcher from the United Way of Westchester and Putnam. A reminder, we will share the Alice report. We'll share a copy of this webinar, a recording of this webinar, and as well as all the links for you to use in advocating, using in future grant applications, requesting funding, and a host of other things. But if you have any other questions, feel free to reach out to us directly. Thank you so much for joining us today and for being a part of this. And hopefully we can all make a difference in the lives of the 40% of our neighbors living below that ALICE threshold one way or another. Thank you so much for joining us.